We are in Takoradi, the twin capital of Ghana's western region on the Atlantic coastline. Takoradi is also Ghana's fastest rising oil city. Behind the veneer of economic prosperity, however, is a socio-economic underworld of broken hopes and dreams.
Ebu abi dubi o ha hu de okomeden awso edidi na bi aka hu na etum de manuma odi ye nyina so ye botum ya aboa wan
wo fa me jenebu mamba no akurawu benyimba no so aka bebi na nse yala.
Peter Amu came from a village near here to seek his fortune in this oil city, but he found his dreams shattered.
Nigeria bad Ghana. Waba Ghana West Africa is a miscan.
For several years, this street corner has been his home.
Oh, Takoradi had a Wadoson hapa because if I'm a second one, baby, be a baby, I wish you be. And she Wadoson hapa.
Holy Child Health Center, a rehabilitation session for the mentally ill, is in full swing. The atmosphere here is different. There is the bonding, the smiles, the creative purpose, education, and above all, collective resolve to get better.
Our aim is to rehabilitate the people to go back into society and live like you and me.
When you are ill, people think you went to do something bad. You try to come out of the problem. You are still stigmatized by society, which is one of the painful things that you go through when you are going through mental illness.
Christ the King Parish, one of the most impressive churches here. Desmond is the dedicated caretaker.
I was working with Texas Council and then they terminated my appointment. I was restless. So I was taken to Accra Psychiatric Hospital, and from there my sister brought me here.
I got to know Mr. Sache in 2005 when I came to work in Damien Daycare Center as an occupational therapist. He struggled for some time when we discharged him. However, he managed to take the initiative and to go and to look for his job. At times he was coming back very frustrated and disappointed that he cannot find job and he's asking here and there and they always take him off. However, one day he appeared and he said, "Sister, I've got job," and he was so happy. I said, "Ayeko Desmond, this really I congratulate you. Well done."
Apollo Town on the other side of Takoradi, this is a community refuge for the mentally ill. Ernest Forson invites us to his home down the dusty, hilly roads on the quieter outskirts of the oil city. This is a serene neighborhood and a wonderful example of how family support can make a big difference.
They have been supporting me very much, and had it not been there, I wouldn't have been able to make it.
A training session initiative by Christian Health Associations of Ghana is in full swing. The focus is on medical staff working in general hospitals. This session is instructive.
The fact that the person has gone through a psychological traumatic situation does not necessarily mean the person is definitely going to have a mental disorder. It has to interact with the other factors present to give you the end result.
The message is that yes, let all health workers get on board and get to know how to manage people with mental health disorders.
What we did have a problem for many years with is that we have a psychiatric care which is institutional, so mostly institutional. We have in the district community psychiatric nurses, but most of the patients are being admitted to psychiatric hospitals. It is far away from the place that people live, so families sometimes can't visit the person and see the progress, see how the person evolves, has the hope that the person can go back and be productive, because that's also an issue. So this, with the new change, with the service being given at the doorstep of the people, will be easier, because then it is quick. You can see the person is getting better. So I can also not be ashamed of that person. The person comes back home, and maybe we'll start from there. Big people talking about psychiatry is very important, but also chiefs, community leaders, just to even be not afraid to visit, to talk to the people with psychiatric problem. I think stigma is part of the stigma is fear of unknown. Most of the time it is unknown, and also the added problem, you know, the spiritual part of the problem. People are always afraid of that it may be not necessarily physical illness, but it's the spiritual part of it.
The era of keeping people in large psychiatric hospitals is over.
Now we want to go all out into the communities. So there's a need to train personnel to be at units in the districts, sub-districts, the community, the CHIP zone. Everybody by the law is supposed to be knowledgeable in mental health, so that at the first point of call, anybody can assess a patient. If they think that it's beyond them, they refer to the next level. This calls for training of staff into the field of psychiatry, from the specialist to the medical officer, to the physician assistant, to the community health nurse. There's a program in Kintampo that is training middle-level personnel.
These are incredibly important times for mental health care in Ghana. A new mental health law has been passed by Parliament, hoping to shift care from institutions to communities.
Ghanaians, we've had a problem. The moment we see somebody with any imbalance or anything, we tend to conclude that the person is mad, and most of the time you find that families don't take care of them.
In spite of the strong stigma attached to mental illness in Ghana, it is now widely believed by both professions and citizens alike that this is a positive departure that will eventually yield great benefits for the years ahead.
We should accept those who are mentally ill in our families. Because now in Ghana, the problem is that people, when they realize that their family members are sick, mentally ill, sometimes we neglect them.
We also have a big role to play. Let us use the pulpit and reach out to the masses who come to our churches and mosques and places of worship. Let us tell them that there's no need for discrimination and stigmatization against mental patients. And when we are able to bring this message across to them, I'm sure when they go to their societies and communities, they will filter this message to other people, so that everybody will be willing and ready to accept those who suffer from mental illnesses and diseases.